All right. 11:04, and right back at it here. Pinpoint Health Show, info at pinpointhealth.ca, and call through now. The phone lines are open right now. 416-870-6400, star 640 on cell. You want to talk to Dr. Lou, this would be the hour to do so. How are you, pal?
This is the hour.
I
really enjoy the phone calls. Last week was quiet. I think we only had a few, but the phone calls always make for more interesting conversation, I think. What are we starting with today? So one thing that I want everyone to pay attention to is the social media stuff. So go follow Dr. Lou and PinPoint Health, because we're going to start doing product giveaways. So
come on, really?
Yeah. So there's lots of different healthcare products that you can have access to win free, right? So why not get on there and take advantage of that? I think that's the first thing that I wanted to bring up. And then, I think this time of the year with let's talk about accidents, like car accidents and things like that, because unfortunately, even on a day like today, a lot of rain coming down the ice, and the things that happen, and we deal with a lot of car accidents. It's not the majority of the things that we deal with, but it's definitely a component. And the thing is, people don't realize how that trauma can affect you long term. A lot of the times, you might not even experience the most severe of the symptoms that are a sequelae of that accident until potentially years later, and the way your body can heal around things. And so it's sad. I've seen a lot of sad cases when it comes to car accidents where people who do a lot of different things in their lives have to stop doing those things, whether it's from a hobby perspective or a work perspective. And it's very, very important that although you may not feel necessarily all too bad following that car accident, that you do get assessed. Now, obviously, hopefully none of this, the biggest goal here is prevention. You don't want to be in an accident. Why I bring it up is because the reality is that this time of the year, it's going to happen. It's going to happen. You're going to be involved in a car accident, and hopefully it's not, and it's not too bad. But regardless, you need to be checked out, especially if there's some type of head trauma. That's a big thing that I've been realizing lately, is there's a lot of people that have some type, and remember, head trauma is anything. Head trauma is a light bang all the way to a very severe bang that, you lose consciousness in. But even if you have any type of contact with your head, whether it's on the back of your seat, the window, the steering wheel, you need to go get checked out. It's incredible how many people I meet that were in a car accident and then they, someone came and picked me up and we just went home.
Yeah.
Right? You want to make sure. It's very, very rare that something more serious, more sinister is going to happen, but why take that chance? That to me just doesn't really make sense, and I think that's why we have the system that we have, so that you can make sure to go get checked. And I think that's a very, very important fact, that if there's any type of head trauma, get that looked at right away. Because that could potentially be life-threatening in some cases too. Very, very rare, as I'm saying. But then, when it comes to car accidents, the vast majority of the complaints that follow that are things like concussion-type symptoms and spine-related symptoms. And, again, they can go on for a very long time. In fact, sometimes for the first week or so following a car accident, you may not even feel too much because the adrenaline, all the things, and then it sort of will set in at some point later. And then all of a sudden you can, not be doing so well. And so that's an important thing to consider. But the point is that if you're driving, you should have car insurance. And if you have car insurance, you also have access to benefits for this type of stuff. And another thing that's incredible is how many people I meet that don't want to use it, take advantage of that. They think that
my rates will go up.
Yeah, something like, my rates go up, and that's totally false. I mean, that's what it's there for. You should be utilizing it for these types of things. Now, that doesn't mean, it has to be extensive treatment, but I do think seeing a professional is very, very important, specifically. And I mean, at PinPoint Health, we deal with this stuff. So if there's a PinPoint Health near you, you can visit pinpointhealth.ca. If you've unfortunately been involved in a car accident, then I think it's something that we can help out with. We also work on the medical assessment side of things, where we can help build cases where we've talked about this before, where sometimes this also becomes a legal issue, because insurance companies are potentially always looking to cut you off and whatnot. And so there's a way to build your case, and medical assessments help with that. And that's more of a personal injury law show type of thing, but it's definitely part of the realm of healthcare where we do work in that area with different types of medical specialists to look at these things and help build the case, which I think is important. And even if you've been, I mean, that sort of leads me into if you've been involved in a car accident and you do have some type of legal claim going on and you're looking for medical experts to help build that. Your lawyers will often have a team of people that they use, but that doesn't necessarily mean that those people are the best in the business. The team that I and the people that I work with have started to put together on the medical assessment side of things are some leading experts in this stuff. So it might be of value if you have something going on, and I'm happy to talk with anybody's lawyer to see if there's a way that we can help build those cases, because I do think it's important to represent the people as well. And I mean, our job as a medical community becomes to decipher between those people that are genuinely hurt and those people that are not. Right? There is a lot of scamming that goes on in this industry too, and that is important. That's our job. We weed that out and we make sure that, but there is a group of people that are genuinely hurt, they genuinely have a problem, and they genuinely need the right attention and the right compensation. So we're here to help those people. We're not interested in lying or creating false claims. It's all about being honest and helping people who need it. We'll
take a short break. You want to get into it to ask your questions about your health, car accident or otherwise. 416-870-6400 star 640 on your cell. Pinpoint Health Show just getting warmed up right here. Global News Radio. 11:14. Plenty of time for you to call in and your questions about your health. Bring it on. That's it's always better when it's a two-way conversation with you. 416-870-6400 star 640 on cell. Pinpoint Health on social, be it Facebook or Instagram, and you can search Dr. Lou as well in that regard. And there's lots of good stuff to be gleaned through social. I know I watch it all the time as well. So get on her, Jim. Hello there.
Good morning, guys. How you doing?
Good, fella. What's up?
Well, I'm not going to toot my own horn here. I've lost about 130 pounds in the last year and a half.
Nice. That's awesome. Good for you.
Since I've done it, my uric acid levels have gone through the roof.
Right.
And I've been getting, well, they call it gout. I don't call it gout because I don't get the soreness, like the burn from it.
Well, gout is increased uric acid levels, so if you have that, you have gout.
Okay. So.
Yeah.
But I know traditional gout goes into the feet. You get that sore toe, that type of things. I'm getting it in places like my knee, my hip.
Yeah, it's possible. So it's more common for sure in the first metatarsal, the first foot, the first Jesus. I'm going to be okay. In the foot, in the first digit of the foot, for sure, it's most common there. But again, it can affect any joint. So it is possible. It's rare for sure. You don't hear a lot of it, but it is possible to get it in other things. Now, the other thing that comes to mind, like right away, is if you've lost that much weight, I'm assuming you're doing a lot more physical activity as well.
Yes.
Yeah. So it could also be a combination of things, right? It could be like, you have high uric acid levels, but I guess at a certain point it becomes distinguishing. Are you feeling mechanical pain in those joints due to more activity and all those things, or are you feeling inflammation from the increased uric acid levels? So have they put you on any medication for?
Yeah, they've put me on a preventative. It slows it down.
Right.
But even like one light dose of it, and like I'm inflamed again.
Right. And then what about in terms of changing your diet? Are you eating a lot more like red meats and things like that? Are you going more of a keto type of diet? Because
I right now I'm more keto.
Yeah.
That's actually how I lost it.
Yeah.
And
that's also how you'll increase your uric acid levels, though. That's sort of, so there's the nightshades, like any red meat, red wine, dark vegetables tend to have more uric acid. So one of the things as a recommendation is usually to also stay away from those things. But again, I get, it's sort of a double-edged sword because it's worked for you for trying to lose weight, but there might be an advantage to, more poultry, fish.
Alternatives.
Alternatives, sure. Right? So you could still stay on the keto, but if depending on how much of the nightshade stuff, anything that's darker, if you can stay away from that, that'll also help with the uric acid levels.
Okay. Yeah, I just found it weird because, all the research that you do and every image that you look at, everything is, it's always in the lower extremities. It's never
Yeah, and that's sort of the problem with doing like Google research, right? You're always going to see the most common thing, but yeah, it can definitely affect other joints. There's no doubt about that. It's just based on gravity and things like the uric acid tends to settle in the foot, but it's not being created in your foot either, right? It's being created in your gut and those things, and it gets disseminated through the blood. So really, it can go anywhere. But again, it tends to settle most often in the foot, but that doesn't mean that I've seen it in other places as well, for sure. But again, I think one important thing, and it might be worth coming to see me, is just to consider, could there be a mechanical component as well, right? Is there some component of that is mechanical, or maybe a little bit of both, which I think is probably most likely, which often happens, right? So it is something to consider.
Well, yeah, because I've gone from over 300 pounds.
Yeah, so that's good for you, though. Right. But I mean, yeah, that's the other thing about when you do start to lose that significant amount of weight, there are going to be these pain issues that arise. More so mechanical. Your example, we're talking about something that's more systemic with the gout, but definitely as you change your body, you do different things like the diet modifications. That stuff could happen. But I one thing that I think is really good is you're not stopping because of this. You're trying to find a way to solve it, and you keep going with your weight loss journey, because I do think it's more important for you to be healthy. And I mean, gout is uncomfortable, but I think you would probably take that trade if someone said you're going to have gout and you're going to lose weight, or you're not going to lose weight and you won't have gout. I think you probably would have taken the gout. So, and there are ways to control it, right? That's the good thing. At the end of the day, it's uric acid. You can do different things to control it and still continue on your weight loss journey.
Oh, absolutely. Now, I did have one other last quick question.
Yeah, sure.
I kind of get conflicted messages on this.
Sure.
Can high acid or uric acid levels contribute to kidney stones?
Yes. So one of the most common forms of kidney stones are uric acid, because there's different ones. So yeah, absolutely, it can lead to crystallization in the kidneys and lead to stones. Yes, for sure.
Because that's my battle I'm fighting right now.
Yeah, for sure. Yeah, 100%. So that's painful as hell, right? So most people, most guys
went through that.
Most guys that pass a stone say it's the equivalent of giving birth.
Yeah, just shoot me in the head. Okay. My dad's like, just kill me now. Yeah, I know what he's going through. My dad was screaming.
But try to control that uric acid, and that'll help with the stones.
Thanks for the call, Jimmy, and plenty of time for you to call through. That's how it works right there. Bring it on. 416-870-6400 star 640 on cell. PinPoint Health Show, Global News Radio. 11:23 on the PinPoint Health Show. You want to reach out to 1-855-55-Dr. That's when we're not on the air. It's PinPoint Health on social as well, like Instagram and Facebook. info@pinpointhealth.ca to reach out by email. So get in there, book a consultation, book an appointment. Get some answers. Failing that, right now on the phone, 416-870-6400 star 640 on cell. We started talking about car accidents this time of year, and you mentioned head trauma. Can you or would you put whiplash in with that as well? I know it's a neck thing, but it's close to the head.
Guess when I say head trauma is if there's actually typically with whiplash. So if you're going to be rear-ended, you can imagine that you whip forward and whip back and hit the back of the seat. So if there's contact of your head with something, that's considered a head trauma. Can whiplash create head-type symptoms? Yeah, absolutely. I mean, our body is connected for a reason. Like this idea that your neck is separate from your head, it's not. It's right there. The muscles, a lot of the nerves that come out of your neck go in to supply the skin in your head. So a lot of those whiplash symptoms, and I mean whiplash, it's a spine-related diagnosis, but for sure, people that have whiplash, one of the biggest symptoms that they experience is headaches. Right? Now, that doesn't necessarily mean that that's head trauma, that there's a neurological, a neuropsychiatric cause to it, but definitely you can have symptoms that happen there. And I mean, anybody that's had whiplash, like it's sort of like one of those terms you just say it and you think like, it can't be that bad. It can be pretty bad. Yeah. Whiplash can be very bad, and there's different degrees of it. You can have whiplash and have neurological deficits go along with it. It can become quite severe, and so those types of that mechanism of injury where your head whips forward and whips back, we're not meant to do that. That is not what we're designed for. And when that happens, that really creates a lot of trauma in the neck. And interestingly enough, a lot of the therapy when you're dealing with whiplash is targeted towards the muscles at the back that you can touch. One thing that I often educate people on is there's something called the deep neck flexors, which are actually on the front of the spine. Those get probably more damage through a whiplash injury, but they're never worked on, right? Because obviously in order to get to them, you'd have to go through your throat, which you're not going to do that. But things that you can't necessarily touch to have an intervention on, you could do exercises to affect. And
really?
100%. I actually met with somebody this week where we were having this exact conversation about deep neck flexors. It wasn't related to a car accident, but they did have chronic neck issues. And the deep neck flexors, as an analogy, is sort of like when we're talking about the core for low back. Right, and that sort of makes sense to everybody.
Makes sense. Good visual.
It makes sense to everybody. The deep neck flexors of the neck are the core of the neck. Like that is the core musculature that you can't target. No different than when you get manual therapy on your back. People aren't necessarily working on your core. You're achieving that through different rehabilitation exercises. The deep neck flexors are unfortunately something that's often forgotten in the treatment of these chronic neck issues. But I mean, when you do it, the benefits of having your deep neck flexors doing what they're supposed to do is tremendous, and you get that neck working properly again. And I mean, that deconditioning of those deep neck flexors, that pain, is also the reason why we have pain with, like, say, working at a desk. It's the same thing. It's a longer mechanism. So you can imagine in a car accident, there's a quick instant where there's an effect on that deep neck flexor. You can equally have an effect on those groups of muscles through long-term, like sitting at a desk and working on a computer and having poor posture. It'll eventually lead to the same thing. It's just one usually happens in a very quick instant, and the other one happens in a slower progression of time. But the outcome can often be the same thing, which is chronic neck pain.
It's really interesting you mentioned that about whiplash, because you think, in the extreme cases, I'm thinking, maybe Dale Earnhardt back in the day when he went into that wall years ago. That didn't look bad, but it killed him. And now they have the Hans device where you can't do that anymore. It pulls you back.
It pulls you back. Yeah, for sure.
It's scary, man.
It's very, very scary. And I mean, your neck is... There's a lot of crucial things there, right? If you fall the wrong, that's why I'm saying even with a whip, like going back to the car accident, if you have a whiplash without head trauma, as soon as paramedics come, if there was some type of an impact that caused your neck to move that much, they often board you in a collar, right? Because it's so important, because if you have a fracture, an unstable fracture in there, it may not necessarily kill you instantly or cause any damage instantly, but you have an unstable fracture and all of a sudden you turn your neck the wrong way or do something, that's bad. That's bad stuff. That's why they'll often board you in a collar, take you to the hospital, get x-rays right away to make sure that there's no fracture. No fracture, take the collar off. But if there's neck trauma, head trauma, those are some very, very serious things that, again, you may not think, like, if it happens right away and you're walking around, you think, well, I'm walking around, I must be totally fine. You don't know. You don't know for sure. That's why neck and head trauma, go get that checked out. Let a professional make that decision. I'm not saying that every single time they'll send you for an x-ray, because you can determine a lot of this stuff based on physical testing, but you don't want to be the person in charge of making that own decision for yourself, or making, like, no different than, saying, you ask your wife and your wife tells you you're fine, or your husband. Like, they are not the professionals.
No kidding.
Yeah. And some of them may even actually want you dead. So,
I mean, when you think about what is your head weigh? What does the average melon weigh?
I think like 8 pounds.
So just go to the gym, grab an 8-pound dumbbell, and just walk around with it in your palm all day
exactly.
and see how far you get.
Point.
Right? Your neck's tough.
Yes,
to take care
100%.
Of it, right?
Yeah.
416-870-6400 star 640 on cell. Bring on your calls. That's how it works. Get some answers. PinPoint Health Show, Global News Radio. Just let that go for a sec.
Jody's the best at this, man. You're definitely the best on the board, Jody. Give you that much.
I had a listener during Greg's show say, man, you going to pay tribute to Neil? A little Rush?
I know.
There you go.
So sad.
Sucks, man. 67.
I didn't even know that. Did anybody know that he was sick? Like, I don't remember hearing that. Yeah,
I knew a year ago because I had a friend who knew. So
was it public? Like, was that no, right?
A pretty private guy.
Yeah, it was pretty private. Yeah, because then all of a sudden, actually, it was on your Instagram that I saw it first.
Yeah.
I was going through and I saw that you commented on that. I was like, what?
God damn, that guy was talented, man.
Oh, he's got to be one of the top
For
5
sure.
best ever drummers. Like he's insane. I remember they used to like build out his drum set around him sometimes. Like he'd be in the middle.
Yeah, it was great.
And he had so many like just.
Did you ever see Rush live?
No, never saw them live.
4 times. Fantastic stuff. Oh yeah.
Yeah, the drums. It's what makes. Well, I mean, all of Rush is good, but yeah, for sure.
Yeah, man.
It's sad stuff.
416-870-6400 star 640 on cell for the remainder of this hour to call in. Get a hold of Dr. Lou here on the PinPoint Health Show at PinPoint Health on social as well.
Yeah. On the break, I think we were talking about something that's really interesting where we're talking about the example of when, like, you've had chronic low back and neck issues and you're doing a lot of stuff to modify, right? And that's an important thing that I talk a lot about with patients is not, you can identify that something is bad for you, right? But that doesn't necessarily mean that you have to stop that thing. And let me actually back up there. You can identify that something is the root of the problem. The example being, let's take neck pain with working at a desk, right? Obviously, we know that working at the desk is what's causing the problem. Now, people think it's an all or none thing. It's like, well, then I can't work at a desk, so I should, quit my job. It's not about that. It's modification. No different than if I meet someone who has a knee issue and we know the source of it is due to running. That I'm not saying never to be active again. There's the important thing here is finding the modification, and you could do different things with almost anything, and that's where a professional is so valuable. And a lot of what we do too is assessments in terms of like homes, workplaces, and those things to really start to look at, okay, we found what the source of the problem is and how do we modify it. And you were talking about how at the gym when you're doing planking, when you do it a certain way, it sets you off, but you found a way yourself to modify it that seems to help you. And that's really important. It's very important for people to try to look, if you're dealing with something, look for the modifications that you could potentially try that will help you, because a lot of these things you may not necessarily, in some instances you may not be able to stop doing it, like working, and in other instances you may not want to stop because it's a hobby. Like if you're golfing and you continually get golfer's elbow and you're getting that epicondylitis and that stuff, that doesn't mean you have to stop golfing. Maybe there's some modification that can be made in the way you grip the club, the way you swing, all of these things that will allow you to bring those levels down, but at the same time allow you to keep going with what you enjoy doing. And I think that's an important thing where people often take this stuff as absolute, like it's an all or none type of potential, where it's like, well, I work and it hurts, so maybe I should stop working. And you hear that a lot, but that may not be the best approach. In fact, I don't think it is. I think the best approach is look for the modification so that you can continue doing that, because work is so much more outside of the money aspect of it, but that social aspect of feeling important. There's an important psychology there. And so I see this a lot with people who have gone off of work for various different reasons. The psychology changes a lot. And they start to develop a lot of depression because you can hate your job, but it might still give you a sense of purpose and all these things. Sure. And that's an important thing. That's a whole different tangent for sure that we're speaking about. But going back to the modification, don't think of things as like, when the last caller we were talking to about the gout, like with the weight loss, like, and he's using keto to help lose weight. I didn't say don't eat meat anymore, right? Like get rid of,
change what you're eating.
Change. There's different types of meats you can modify. You can figure these things out for sure.
416-870-6400 star 640 on cell. It's 11:37. Got lots of time to call in with your issues if you have any. Would like to discuss. Feel free to call in. It's funny you mentioned the planking at the gym. It's also a matter of fact where I don't think you can, once you get used to doing something or your body gets used to doing something, you can't sit back in your laurels and just accept it. Yeah. Because a regular plank was getting too easy, so the modifier was like,
that's
holy
huge.
Crap, this thing's difficult
to prevent
now.
Adaptation.
Right.
Yeah, 100%. Yeah, that's huge. And in anything, and I use that example a lot, right? When I see people, I've met tons of people that have come to see me over the years through the radio show who, when I say, well, have you ever done rehabilitation? At the clinic you were at or the professional you were seeing, yeah. They gave me a sheet of paper and they told me to do this and I did this, but and it's like, that's the wrong approach because of what you just said. Your body is designed, humans, not just your body, everyone's body, humans are designed to adapt to their environments, okay? We adapt. So if you give somebody a sheet of exercises that they do, at a certain point, you're not going to achieve any more results. No different than if you said, well, I want to make my bicep bigger. And you give someone, okay, we'll do, bicep curls 3 sets, 15 reps at whatever weight. If you don't do something to change that and you keep doing that, you're gonna plateau very, very quickly. And rehabilitation is and in general, taking care of your body from a healthcare perspective is very, very important. It's the adaptation component. It also, the adaptation works on the therapy intervention side of things, right? You can try, it's no different than when people try a new diet for the first time where they can achieve incredible results right away, right? And people are always so quick to say, like, I've been doing this for 3 weeks, it's the best thing ever. But that's usually because your body's just not adapted to it yet. So it's something totally different. And then over time, those people all of a sudden will start to say, the results aren't the same, no different than, again, on the therapy side of things, when someone's taking a certain dosage of a medication, sometimes you reach a threshold, like you can meet someone who's never taken a Tylenol before, and then all of a sudden they have a headache, they take a Tylenol, and it's the best thing since sliced bread. But at a certain point, that one Tylenol then becomes 2, then it becomes that every 4 to 6 hours, because, again, there's a level of adaptation that happens in any instance, even on the therapeutic side of things. And that's an important aspect to understand about us, about being human, is that we are designed to adapt to everything in our environment, no matter what it is.
You got to keep it moving. You got to keep it interesting, or your body gets used to it.
You got to do different things. You got to change it up, and that's very important. On the therapy side, it lends to the reason why you shouldn't become sort of hooked on any one intervention. You should be trying to wean off.
Right. Don't run out of time. If you want to call in, get your questions answered. There's always a big influx at 5 to 12 where we have no time. So now would be the time. 416-870-6400, star 640 on your cell. PinPoint Health Show, Global News Radio. 11:43 it is for the remainder of this hour. That's the time you have to call in and talk about your condition. Could be anonymous. Doesn't matter. If you want to get some answers, or at least go point in the right direction. 416-870-6400, star 640 on cell. When Dr. Lou is not here, PinPoint Health, at PinPoint Health is the way to go on social, or info at. You can email anytime, and the phone number 1-855-55 Lou, DRLOU. Just that simple.
And take advantage of that. I mean, that's a conversation. If you have an issue, it might just be some simple advice like we do here on the radio that can point someone in the right direction. So, a lot of people are taking advantage of it, but for sure there's people that don't take advantage of it. You should, obviously, if this is an emergency, do not call 1-855 Dr. Lou. You call 911. But for things that are not emergencies and you're wondering, you have a question, you're unsure, I'm really here to provide a service, and it doesn't cost you anything to do that, right? There's nothing about it. It's just really a way for you to maybe sort of get pointed in the right direction. And I'm happy as the calls have ramped up over the years. So I have someone who screens it right now, and then if it's something that needs to come to me, but definitely if you want to have that specific conversation with me, I'm happy to do that, right? Like, and you can request that to the screener where you let them know, like, no, this is something I really want to speak to Dr. Lou about. A lot of things are people at this point, they sort of know, so it's just like, I want to book an assessment, which is why we're screening it, because I don't do that aspect of it. But if you want to speak to me, it's just simple. Leave it in the message, or when you speak to the screener, just let them know that you want to speak to me, and I will give you a call back. Let them know a good time. I'll do my best. I try to be pretty available.
You can't deny the possible, and we talked about this a little bit last week when it comes to placebo, the therapeutic effect of just having a conversation with you and realizing, you know what, you're not on death's door. It's okay. I think I have an idea what this is. Not a big deal. Come in and see me, and then the rest of the weekend they feel much better.
Yeah,
before they even come in to see you.
I had a person, before we get to this next caller, I had a person this week that had pretty severe stenosis that was leading to a lot of pretty much all of the sensory stuff in the lower limb was, I don't want to say shot, but it was there were definitely significant findings, right? But they've been going through this for years, and they've seen a lot of people. And I sat with them and just explaining to them, they were so much more confident. Like, and it wasn't like I was sitting there saying, oh, we're going to have a cure for you or anything like that. I just gave them the reality of the situation, that at some level you have to accept what's going on. There's things you can do to modify, to slow down the progression, and the reality of it. Just made it that. Did we just lose that call?
Yeah, Henry was there. I don't know. Henry, call us back if you dropped your phone or something. Again, 416-870-6400.
Yeah. So going back to what I was saying about this patient this week, but that aspect and using the placebo in terms of the interaction, just the fact that I'm available to hear you out is a placebo effect that I'm sort of giving. And I don't say that in a negative. Placebo is something we should all be taking advantage of, so long as it's not, $20,000 of some therapy intervention or whatever. That's where it gets a little dicey. But definitely from an interaction standpoint, the positivity, the willingness to explain. And I think if someone were to ask me why you over somebody else, like what is the distinguishing factor, and this isn't me tooting my own horn, but I think the distinguishing factor is the level of information that I provide to someone. I don't think anybody, I don't think most people would say that I don't think I do much different in terms of a physical exam, like compared to someone who's equally prudent, right? Sure. Like you can do, but it's not that. I think where the true difference is if you're looking for, and the biggest complaint often in healthcare is, I didn't get an explanation, or someone only spent 3 minutes with me and then I was out of the office. If you're tired of that approaching, you want someone who spends a lot of time with you, gives you those explanations. That's the value-added service that I think I bring to the table, and that's really my goal is to provide that. I really want to make sure that people understand what's going on, and I provide the very best in evidence for them. And yeah, I mean, even another person that I was seeing, and I was mentioning to them about rehabilitation and therapy, and they said to me, because I was telling them to only do therapy when they were symptomatic, they had a chronic issue, and I was saying, only really do therapy, and the person said, well, you would think the fact that you own therapy centers, you'd be recommending like consistent therapy to everybody all the time. And I said, no, that's not the point of what I do. The point of what I do is to provide the right information. If someone does need therapy, that's why we have therapy centers for that very reason. But I'm not looking to trick people into therapy. I'm looking to provide therapy when it's absolutely required based on the scientific evidence.
Plus your exposure on this radio show.
The accountability,
you can't be a scumbag.
No, the accountability is huge. I mean, right. and as we build out the social network, we're working on a podcast on Spotify and iTunes, which there's more to come on that later. But that accountability level, I'm not here to rip somebody off, right? Like that's not the objective. The objective has always been that I truly believe that there's a lot of misinformed people in healthcare, and healthcare is something that we all do or use at some point. And there's a lot of bad information out there, and I think if you're looking for that credible source, again, maybe I'm biased, but I try to be as credible as possible because of the accountability factor of this radio show, for sure.
And as you mentioned before, the problem with searching for something on Google, you will eventually seek it and find it, what you're looking for. So you got to be really careful about that. Right?
Yeah, and a lot of the times you can see the very worst thing, right? You could type in at the end of the day, there's it's funny because there's only so many symptoms humans can experience. It's the combination of, right? So if you type in fever, this, that, right away, stage 4 cancer, that is
might not be you.
Yeah, it's not necessarily there. There's only so many symptoms that we can experience, and it's usually the combination of them in which order they happen, and that's what you can't distinguish on Google, right? Like if you type in, headache, this, that, you're not distinguishing, well, when did that happen? When was the first time you noticed it? How long has it been going on? That's really what paints the investigative diagnostic picture, which is the job of a healthcare professional. And, if your diagnosis is wrong, then I can almost guarantee you that the treatment's going to be wrong.
416-870-6400, star 640 on cell. Got a few minutes left, which means you have more time to call in and ask your questions here. Pinpoint Health Show, Global News Radio. Pinpoint Health Show, anytime, 1-855-55 Lou, DRLOU. That's when we are not on the air. Pinpoint Health on social, like Instagram and Facebook. There is tons of stuff to be viewed, read, and learned on the social media feed with Pinpoint Health, so it's gaining momentum all the time. And email info@pinpointhealth.ca as well. Sharon, thank you for hanging on. Good morning. How are you?
Good morning. I'm fine.
Great.
I'm just tuning in late, but I got the part about the Tylenol, and I've been experiencing a lot of leg pain, my ankle, my heel, my knee, back, front, sides, everywhere, right up my leg, and it's sporadic. It goes from one place to another. I'm finding it very hard to walk, extremely hard to get up from a sitting position, and it takes me a while to get everything into gear before I can walk, whether I'm in bed or sitting. And I have been taking Tylenol to ease the pain. It does not eliminate it, but it eases it for a bit.
Yeah. So my first question, Sharon, sorry to interrupt you, is have you seen anybody about this?
I did see a doctor just this week, and he's going to order some x-rays.
Okay.
For me.
Can you describe your, is it like a numbness or pins and needles type of sensation in the leg, or is it pain, like a sharp pain? Can you describe the character a little bit?
It's a sharp pain. Very
sharp pain. Is it specific, like you could draw a line, like it almost feels like a nerve pain, or is it right in the joints?
Well, I don't think it's in the joints because it wouldn't be on either side of my ankle, and I don't think, not being the doctor, but in my knee, it feels like it's in that, like a muscly thing. I don't feel like I do have cartilage.
So like soreness
up on my knee. But
how old are you, Sharon?
72.
72. Okay. And has you mentioned something about walking? So if you're walking, do your legs tire or anything like that? Like do they become sort of weak and heavy, or is that not what's happening?
Somewhat, but I think my opinion for myself was that it's just I can't tolerate the pain anymore. Mm-hmm. And I am a walker, or I used to be, but it's a big effort. But the biggest effort is sitting down, because it's the getting up
that really bothers it. Yeah,
a lot of pain.
And you're having X-rays of what? All those different areas?
Yes.
Okay. When did this all start?
Well, it's been really intense for about the last 4 months, I would say. And every once in a while I would get a little, because I had a knee injury about 12 years ago. Mm-hmm. I could feel that cartilage sort of moving around there. But maybe once a year, maybe not. But I've always been an avid walker. Mm-hmm. And I'm at the point now that I can't tolerate the pain anymore.
Right.
And so I only take Tylenol because the cardiologist says you never take blah, 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 these other ones. And I just, so I stick to Tylenol if I need it. But I don't want to take more. I'm taking 6 a day of the extra strength. Mm-hmm. And that's my story. So
okay.
If I was on the right track or not, I don't want to.
Well, I think so yes and no. I think there needs to be more investigation done. Like it's very hard for me over the radio to figure out what could be causing this leg pain. I have thoughts of what it could be based on your age and some of the symptoms, but there's too many to sort of try to decipher which one's which. But I think you seeing professionals and starting to investigate that is very, very important, right? So I think the Tylenol and those things, it's going to mask it where it can, but it's not going to look for the root cause, which will help you to look towards a solution, right? This is sort of, you're providing a Band-Aid right now, and I think you're sort of at the point where, based on how severe it's become, you're looking for more of the root cause. And once you can identify that root cause, then all of a sudden the options for treating it will become much clearer. But it's too hard for me over the phone and over the radio here to sort of determine what it could be. I mean, it could be generalized soreness, it could be neurological, it could be systemic. There's a lot of things I think that need to be investigated. So I think the biggest thing is just having the right person to do that investigation. You're seeing who? Your family doctor?
Yes.
Yeah, okay, good. So I continue seeing your family doctor and don't let up on it. Don't assume that, it should just go away. Continue the investigative process until there's an answer there. And sometimes that requires you, the patient, to put some pressure on the doctor too to get to answers, because sometimes as healthcare professionals we can become a little lazy and sort of tell people, okay, well, it should get better, or but sometimes it's about keeping the pressure on those people as well.
Right. Well, I appreciate your opinion. I just wondered if, like I'm probably 2 months too late calling you, but it was the case of the Tylenol, like how much is too much and how long is too long, and I appreciate
the Tylenol stuff again. For me, that's I was using that example. I don't even remember what I was using, but I think towards adaptation, and I just used Tylenol as the example. Okay. I think when you have physical problems, you need a physical intervention to try to solve them, and so I don't think the biochemical approach is often the best. So that's why I'm saying getting it diagnosed the right way might make the treatment much clearer. And once you have the right diagnosis, you can plan for the right treatment to either help, get rid of most of it or at the very least manage it so that you can live your life. And that's what PinPoint Health is all about. It's all about getting the right diagnosis so that you can get the right treatment.
Sharon, appreciate the call. Please circle back with us when you get some more answers in the future. Now that we're done for the day, 1-855-55 Lou, DRLOU. info@pinpointhealth.ca through email and online with social, especially. Lots of stuff to be viewed there and listened to. It's at PinPoint Health, Instagram, Facebook, etc. Join you next week here on the PinPoint Health Show, Global News Radio.